We'll begin this conversation taking a quote first from Miguel de Cervantes, who once said, "Every tooth in a man's head is more valuable than a diamond." Absolutely spot on. My next quote is from Dr. Seuss, once said that feet are always in style. What does that even mean? I'll take my next one. And this one is from Henry Boyd, once said, "There are three proven rules for good teeth. Brush after every meal, see your dentist twice a year, and mind your own business." How does that have anything to do with taking care of your tooth or your oral health? All right, my next one is from Charles Gordy, who once said, "A smile is an inexpensive way to change your looks," and I agree with that one. My next one will be from Johnny Carson. "Happiness is your dentist telling you it won't hurt and then having him catch his hand in the drill." I agree with that one. All right, my last one from Mallory Hopkins, who once said, "Life is short. Smile while you still have feet." Don't you agree with that one, or don't you just love this quote? Let's see how this quotes relate to what we'll be discussing tonight. Very warm greetings and welcome to D Conversation. We're reaching you from Kaftan's television studio here in the nation's capital, Abuja. My name is Annabelle Oji. Today, we'll turn our attention to oral health as Nigeria is joining the rest of the world to commemorate World Oral Health Day. And I will be talking to two persons. My first guest is a representative of World Health Organization, and also I will be talking to Olamide Alhassan, who is Kaftan TV's health correspondent. But let's go on this quick break, and when we return, we'll continue this conversation on oral health. Ladies and gentlemen, this is D Conversation. Welcome back. If you just joined us, this is D Conversation. We're reaching you from Kaftan's television studio here in the nation's capital, Abuja. Today, Nigeria is joining the rest of the world to commemorate World Oral Health Day. I'm sure a lot of people will be asking, why don't we talk so much about oral health? So my guest on the show today is Dr. Yuka Makino, who is Technical Officer for Oral Health at WHO, that's World Health Organization. Great to have you on the show today, Doctor.
Thank you very much for your invitation. I'm very great honor to join your TV show. Thank you very much.
Great. Thank you for coming on the show today. Now, since we're commemorating World Oral Health Day, let's start by talking about oral health. Why exactly do we have to set aside a particular day to talk about our oral health?
So WHO define, oral health is not only the mouth and then the oral disease, but actually oral health is beyond the function, but also, linked with chewing and also speaking. And also, therefore, that is linked with, communicate with others, and also linked with well-being and also quality of life. Therefore, oral health is not only just oral health, but also linked with your, participation in the society.
Oh, great. Okay, so now can you provide us with information or an overview of the current oral health crisis that you have in the WHO, especially in the African region?
Yes, thank you very much. I mentioned about oral health, but at the same time, we suffer a lot of oral disease. So mainly oral disease, including dental caries, tooth decay, and periodontal disease, gum disease, and also the oral cancer. So these, oral disease, actually in WHO African region, indeed, around 44% of our population is estimated to suffer from oral disease in 2019. Actually, this is the most, high prevalence among other diseases.
Issues, especially looking at the African region, what is the cause for that high prevalence in these challenges you find?
Yes, of course, African country doing well as much as possible, but we also face some underinvestment. For example, especially we also lack the public health measure to address, risk factor for oral disease, such as, lack of access to the fluoride. As you know that fluoride is actually, contribute to prevent dental caries, but at the same time, we do not have a lot of public measure to improve the access of the fluoride in this region. And also, oral disease is caused by a range of modifiable risk factors such as sugar, diet, and also, use of tobacco and also alcohol. Then we do not have a much, measure to address these risk factors. That is one of the reasons for that, disease burden. At the same time, we also face the lack of access to oral health service. I think that Nigeria, maybe you can access to the oral health service at the district hospital level, but much country, do not have a lot of access for oral health service, and also the especially primary care level and a community level, quite difficult to access to the oral health service, including the oral health promotion, oral disease prevention, and control.
All right, great. So now let's talk about poor oral health and its impact on the average human being, regardless of where you are, in Africa, in Brazil, in the United States. What exactly can you tell us?
So indeed, according to the World Health Organization's Global Oral Health Status Report, which was published 2022, nevertheless, despite or beyond all the income level, from the high income level or low and middle income level, and then the low income level, actually oral disease is the most prevalent disease. That is the universal situation, and also the risk factor which affect the oral disease it is the same. As mentioned that sugar, diet, and also the tobacco, and also alcohol, and also lack of access to the fluoride is actually main cause of the risk factor. That is, universal situation. That is not only in that certain specific area, but that is overall general situation. I hope it is clear.
Okay, so I hear you talk about the universal situation. I hear you talk about tobacco. You talked about alcohol and all, but then let's accept the fact that a lot of people might not be able to do away with tobacco, with alcohol. So if for those kind of people that say, okay, I still want to stay with my bottles, or I still want to stay at least, but I will reduce it, but at least still stay a little bit with tobacco, how can they deal with oral health issues?
Because as mentioned that the alcohol and then the tobacco is actually affect for oral disease. Such as tobacco is actually affect and also the cause the periodontal disease, gum disease, and also oral cancer. And then the alcohol especially cause the oral cancer. But this is not only, affect for the oral disease, but also this is also risk factor or general, disease such as cancer or other, chronic disease. Therefore, we also ensure the population that this risk factor is not only, affect your general health, but also oral health as well. In addition, of course, the dental clinic or primary care level, we can also do some of the session in order to support the patient to reduce the use of tobacco and also the harmful consumption of alcohol. But at the same time, not only the support for individual level, but also it is quite important to take public health measures such as tax for tobacco and alcohol. This kind of enabling environment also support individual to quit these harmful behavior.
Oh, great. Okay, now, so speak to us specifically on what WHO is doing with regards to oral health issues, especially in the African region.
So thank you very much. As mentioned that now I work in WHO Regional Office for Africa, and then we have mainly 4 functions. The first function is actually related to the leadership for oral health. And then second function is actually linked with generate the evidence. And then third function is linked with development of the technical material. And then fourth is actually provide the technical support the country. So in terms of the leadership, we actually produce the global and regional direction for oral health. So we support country to utilize this kind of regional guidance to implement national oral health plan at the country level. Then second point, as mentioned, that we also, try to produce the strategic information that also can support, regional level to understand current oral disease burden. And also we support this kind of information, support country to understand and also develop and implement evidence-informed oral health strategy. And then third point, technical, material. Especially last 2 years, we developed the online course which support, national level and local level related to the, increase the knowledge of oral health. Then this is actually free, assessment online course which we produce by ourselves. And then fourth part, as mentioned, that we also support country, including Nigeria, to develop and implement national oral health strategy in line with regional and global, strategy on oral health.
Oh, great. Okay, so speak to us on successful programs that you must have embarked on as a body, as an organization that has actually worked for you. What are the successes? And tell us your success and at least maybe some of the challenges that you face, especially when you're working in this part of the world.
Yeah, thank you very much. In terms of the success, I would like to congratulate the Nigeria success. Indeed, African Region Office, we work with, Nigeria related to oral health general, but NOMA. So NOMA is actually disease of mouth and face, and they actually especially affect for the children between 2 to 6 years old, especially under malnutrition, and also the lack of access to the health service, and also vaccination, and also especially the underprivileged, population. Indeed, Nigeria actually a part of the regional NOMA control program, and then we worked together with Ministry of Nigeria and also the WHO country office Nigeria in order to implement national NOMA control program. So Nigeria doing really well for training of the primary care worker in terms of the capacitated primary care worker in order to promote oral health and then the detect NOMA and also treatment, especially the early stage of NOMA, and also refer the NOMA into the district level hospital. Indeed, they're also doing well in terms of the training of the community people because NOMA, the affected population, maybe they are not access to the health facility. Therefore, it is also quite important to raise awareness and then train of the community people in order to promote oral health and also detect and then refer NOMA cases in the health facility. Other point is, in Nigeria, you utilize a sultan in order to raise awareness NOMA. Moreover, you also did the social mobilization in order to reduce the stigma of the NOMA. At the same time, I also would like to congratulate Nigerian effort because WHO have a list called neglected tropical disease. Indeed, Nigeria government took the leadership in order to integrate NOMA into this neglected tropical disease. Indeed, Nigeria get the support from 31 other countries, and then they actually submitted the request to WHO Steering Advisory Group to integrate NOMA into this neglected tropical disease list. Actually, thanks to Nigeria effort, the WHO officially recognized NOMA as a neglected tropical disease last December. This is really, great milestone in terms of the NOMA control because the potential integration of NOMA into this neglected tropical disease raise awareness NOMA more, and then potentially the international and then the regional organization can invest more for NOMA issue. Therefore, this is really wonderful achievement led by Nigeria government. Therefore, congratulations.
Absolutely spot on. I like to hear things like that. Great. Okay, so now let's go on a quick break, and when we return, we'll conclude this conversation with Dr. Yuka. I will see you after this time. Join us again. If you just joined us, this is The Conversation, reaching you from Kaftan's television studio here in the nation's capital, Abuja. If you actually just joined us, you've missed out on the first part of the show, but then we'll still continue as we were talking about oral health. We're joining the rest of the world with Nigeria and other parts of the world. We're commemorating World Oral Health Day, which is celebrated or honored or commemorated every March 20th. And to see how we can, at least let's see how we can conclude on this matter. My guest on the show today is Dr. Yuka Makino, who is Technical Officer for Oral Health at World Health Organization. Thank you for standing by, Dr. Yuka.
Thank you very much.
Great. All right. Now, before we went on that show, I hear you congratulate Nigeria and say at least you're getting good support from Nigeria. Now, for those indigenous people, especially in Nigeria or in Africa, how can community leaders, traditional leaders, religious leaders in whatever community they find themselves, whether in Nigeria, in Tanzania, in Ghana, in Botswana, wherever they are, how can they help also to facilitate your efforts in what you do, especially with regards to oral health? What exactly are you expecting from the community leaders, from the traditional leaders or the religious leaders in every community they find themselves?
So thank you very much. So I mentioned that Nigeria is actually leading the normal control program. And then I also would like to, take example from this normal control program, because as mentioned that the one of the sultan from your country is a part of that, the role model of this normal control. Because, traditional leader is actually role model of your community. Therefore, there is very influential. Therefore, if they can raise awareness of oral health issue, the community also follow. Therefore, they can have a power to mobilize society and also raise awareness of oral health issue, and also address the stigma and also reduce the stigma linked with oral diseases. Therefore, they can be, traditional leader can be the champion for oral health issue in the community.
Okay, great. All right, now let's talk about prevention and awareness. What kind of support are you expecting from these traditional leaders, from the communities also?
Yes, as mentioned that the risk factor for oral disease, as mentioned that diet high in sugar, and also the tobacco and alcohol, and also lack of access to oral, fluoride issue. Therefore, for example, the traditional leader can address about this kind of risk factor issue during the, town hall meeting or any other opportunity. And then this actually also helpful to raise awareness of oral health issue among the community. And also potentially, because they are also influential for the local government, therefore they can also address the right to access to oral health care. Because especially in our, countries, it is quite challenging to access to oral health service. Therefore, they can also advocate the government the importance of the improved access to the care, because that is the human rights to access to the oral health service.
Let's bring it back home and then talk about maintenance and prevention and all. I hear someone say that if you want to brush your teeth, you have to just like brush straight. Like, are there ways that you can actually mentor, teach us on what are the things that you need to do aside from abstain from alcohol, abstain from all of that? How do I maintain a good oral health so that when I'm talking to someone, I don't have like someone is trying to cover their mouth and say, oh, that mouth is oozing?
So, as mentioned that the oral disease is really prevalent, as mentioned that 44% of our population suffer from oral disease. But good news is we can prevent oral disease by very simple method. The first, as you mentioned, that we can brush teeth, especially with fluoride toothpaste twice a day to prevent dental caries. Twice a day with fluoride toothpaste. And then the second is, as mentioned, that we need to, control the take of the amount of the sugar such as, reduce the consumption of the juice and also reduce the consumption of the sugar sweetened some snacks. And then another point is avoid any form of tobacco, as mentioned that in order to prevent oral cancer and also gum disease. And another important point is limit the consumption of the excessive alcohol in order to prevent oral cancer. So these simple 4-step prevent, oral disease, but also that contribute to prevent general disease such as cancer, diabetes, cardiovascular disease as well.
Great. All right, then I hear you talk about fluoride. Use the fluoride toothpaste, but I read something online. Someone said it's better to go for the charcoal toothpaste. Would you agree with that, or use charcoal?
According to, WHO guidance, we recommend to utilize fluoride because fluoride, already evidence that they contribute to prevent dental caries. Therefore, we recommend to utilize fluoridated toothpaste, especially the toothpaste included around 1,000 ppm to 1,500 ppm contents of fluoride into the toothpaste.
All right, great. Even as we begin to round up, what does the WHO plan to support, or how exactly do you plan to support developing countries, especially, and then the global community in terms of oral health? What exactly are the plan? Because I hear you talk about plan, you talked about strategies. Could you please reel that out for us?
Yes, as mentioned that we produce the global guidance on oral health and also regional guidance on oral health. Then each country need adapt and implement these strategy at the country level, considering the country context. For example, Nigeria, we work with the Federal Ministry of Health to implement this global and regional strategy in the country level. Also, as mentioned that we also try to capacitate, especially build the capacity of the oral health focal point in the Ministry of Health in our member states to promote oral health in the national level.
Great.
But this is including such as, strengthen leadership on oral health in the country level, including the increased commitment for oral health, politically and financially. And then we also support country in order to promote, oral health and then prevent oral disease, especially that address the risk factor. And then the third point is we also try to country to strengthen the oral health workforce because as mentioned that we face the chronic lack of oral health workforce in this region because we only have a 0.33 dentists per 10,000 population in this region. And then another point is we also support country to increase access to the oral health care, especially the primary facility level. Then we also support for the increased access to the essential dental preparation and medicine. And the also important point is because we do not have much information related to oral health. Therefore, we also ensure country integrate oral health issue into the national surveillance system. And also we think that's quite important to support country to put oral health as a part of the national health research agenda.
Oh, great. Great. Absolutely spot on. Thank you so much, Dr. Yuka. But before we let you go, we'd like to get your last words to Nigerians, Africans in general, whether you're in Ghana, you're in Botswana, you're in Zimbabwe, even in any part of the world. Since we're commemorating World Oral Health Day, what are your last words to people, individuals, families, corporate bodies?
So definitely oral health is beyond oral. As mentioned that oral health is a contribute to your well-being. Therefore, I hope that you're mindful of your oral health and then your family's oral health. And then let's promote oral health and your general health and then contribute your happy life. So thank you very much for your inviting me to this great show. Thank you so much.
Thank you so much. It's been a wonderful time talking to you, Dr. Yuka Makino. It's been a wonderful time having this conversation. We've been chatting with Dr. Yuka Makino, who is Technical Officer for Oral Health at the World Health Organization. And it's been a wonderful time here on the conversation. And so let's go to a quick break. And when we return, we'll bring you some other reports on oral health. See you later.